What's up, guys? So we have a full respiratory assessment coming up. We have Kimberly in the chair being our patient. We have Jenny and Viri as our EMTs. Viri's going to take team lead in this instance. Dan in the corner right there is going to be our proctor. And so we're going to run you through what it looks like to be team lead, what it looks like to be a team member for that team lead, and what to expect from your proctor as far as how much info they give, and what the EMTs are expected to ask of the proctor. And so if we were to start right now, Dan, as the proctor, how would you start off the situation, the scenario?
Well, first I'm going to dispatch the students.
Okay.
So I'm going to tell you guys, you're dispatched for a patient with difficulty breathing. Your patient is a 60-year-old female who believes they are having problems with their COPD again.
And then the scenario starts. So Viri, go ahead.
All right, so as we approach the scene, the first thing is we have proper personal protection. So I have my mask on, pretend that I have gloves on. I assess the scene. Is my scene safe?
Your scene's safe.
Is this my only patient?
You only have one.
And according to the dispatch, I'm going to say it's a nature of illness because it's a respiratory issue. So my nature of illness is respiratory. And then I'm also going to ask for additional backup, so I'll request ALS.
Okay, they tell you to handle it by yourself.
All right, so they're not available. So I'll approach the patient. My general impression of this patient, we have a 60-year-old female who looks to be having a medical emergency. Hi ma'am, my name is Viri. This is my partner Jenny. We're with EMS. What seems to be the problem today?
Just having a really hard time breathing.
Okay, so the patient's chief complaint is that she's having a hard time breathing. So I'm going to ask you a couple of questions if that's okay. Could you tell me your name?
Natalie.
Do you know where you are, Natalie?
I'm in my home.
Okay, do you know what day it is?
It's Tuesday.
Okay, and then do you know who our president is?
Donald Trump.
Okay, so because she answered all 4 questions correctly, I'm going to go ahead and say she's alert and oriented times 4. Our patient looks to be sick. And ma'am, did you fall today at all?
No.
And she's sitting, so we're going to go ahead and say that there's no need to take C-spine precautions. And yes, I think that's it. So I think we're going to move on to our ABCs. So under airway, the patient was talking to me, so I'm going to go ahead and say that the airway is clear, it's patent. So we don't have to do anything to remove any obstructions. And then going on to B for breathing. What's the patient's tidal volume?
So their volume is adequate.
Okay, their respiratory rate?
It's a little rapid.
What's the pattern?
It's regular.
Okay, are they using any accessory muscles?
Yes.
They are. So I'm going to have my partner Jenny, could you please apply a pulse ox to the patient and could we get an SpO2 reading?
Sure.
I'm going to put this on your finger, okay?
Okay.
All right, so your pulse ox tells you that you're at 86%.
Okay, and then my partner is also going to take a set of lung sounds.
Okay.
And then as she does that.
Can you breathe in for me? A deeper breath. Breathe in. Breathe in.
All right, what sounds did you get, Jenny?
They're clear bilaterally.
Okay, so your actual patient has wheezes bilateral.
All right, so we have a patient with an SpO2 reading of 86% and they're wheezing bilaterally. So I'm going to go ahead and have my partner set up a neb kit. Jenny, could you please set up a neb kit with albuterol and Atrovent? And then for the oxygen tank, we're going to have a flow of 6 liters per minute of oxygen.
Okay.
Our patient is in respiratory distress, and that's why we're setting up this, and it'll also give some supplemental oxygen because it's on 6 liters.
Okay.
So now we'll move on to C, circulation, while my partner sets this up. So do we see any bleeding, any visual bleeding?
You don't see any bleeding right now.
All right, I'm going to
See the dosage.
So for albuterol and Atrovent, we have 2.5 milligrams of albuterol, and then we're going to have 0.5 of Atrovent, 0.5 milligrams of Atrovent. And it's all going to go in there together.
Okay, we can carry on with circulation.
All right, so there was no major bleeding.
No major bleeds?
I'm going to go ahead and assess my patient's pulse. When I do this, I'm looking for relative rate, strength. So I'm gonna go ahead and check your pulse if that's okay, all right? So I'm gonna use this hand just a watch, but so I'm gonna take my 2 fingers, go on the radial, check for radial pulse. I'm looking for strength.
Okay, so it's strong.
I'm looking for rate.
It's fast.
And then regularity.
Regular.
And then checking on both sides, I'm gonna look for equality.
Okay, it's equal.
All right, so I do that. And can I get the patient's skin conditions?
Sure, they're warm, dry, and pale.
Okay. And then the cap refill.
Your cap refill is adequate.
Okay, so based on everything, I'm gonna go ahead and say that my patient is not in shock. So we're not gonna do any shock treatment.
Hold this and then breathe
So my patient now has a neb kit, and at this point, I'm gonna say that my patient is a priority patient. So I'm gonna go ahead and we're gonna go ahead and load the patient. We're gonna go to the hospital, and then the rest of my assessment is gonna be done on the ambulance. So I'm gonna go ahead and take a history. So starting off, I'm gonna ask my patient, do you have any allergies?
No.
Are you on any medications?
Albuterol, but I just ran out.
Okay, so do you have any past medical history?
COPD.
COPD?
And I'm a diabetic.
Oh, okay. What was the last thing you ate or drank?
I had lunch about 20 minutes ago.
Okay. And what were the events leading up to this episode?
I was just sitting on my couch watching TV.
Okay. Do you have any additional symptoms?
I just feel short of breath.
Okay. So what's does anything make it feel better or worse?
It helps with my rest.
Okay. Did this come on all of a sudden, or was it over a couple of
It's
days?
pretty sudden.
Pretty sudden. Could you describe what you're feeling? Is it pain, or are you just
It's
having
just really difficult to breathe.
really difficult to breathe?
Hard to catch my breath.
And then so it's just your breathing. Do you have any pain anywhere else on your body?
No.
And then could you rate your difficulty of breathing on a scale of 1 to 10, 10 being the absolute worst?
Probably a 7 or 8.
Okay. And then how long ago did this begin, you said?
Maybe 20 minutes ago.
20 minutes? Okay. So after taking history, do you know if I missed anything, Jenny? No? Okay. We're going to go on to a focused secondary assessment. And then because this patient is respiratory, we're going to go down a respiratory second assessment, focus assessment. So for this one, I'm going to assess my patient's, how is my patient sitting?
So they're sitting just like that.
Okay, so they're in a tripod position. I'm going to ask for a second set of skin conditions.
Okay, your skin conditions are warm, dry, and pale.
Okay, is there any jugular vein distension, JVD?
No JVD.
And then could I get a second set of lung sounds?
Okay, your lung sounds are clear now.
Okay. And then I think that's it. Do you know if I'm missing anything, Jimmy?
Did you look for JVD?
Mhm,
Tracheal
no.
deviation?
And then a secondary SpO2 reading,
Okay, your SpO2 is at 90 now.
90%. Ma'am, are you feeling any better with the
I
neb
still
kit?
feel really short of breath.
Really short of breath? So now we, and then you said the lung sounds are clear now?
Yep, your lung sounds are clear after your neb kit.
Okay, so the lung sounds are clear. The SpO2 is still at 90%, which is too low, and the patient's complaining of shortness of breath. So we're gonna give her supplemental oxygen. We're gonna go ahead and do 15 liters of oxygen via a non-rebreather mask. That's high flow oxygen.
Okay, what's high flow?
15 liters.
Okay, great.
I'm gonna put this on your head, okay? You actually.
Okay, so and then one last thing. Do I see any tracheal deviation? So
No tracheal deviation
No
or
tracheal
tracheal tugging.
okay. So after we give the treatment, I'm gonna go ahead and ask my partner to take a set of vitals.
Okay.
So I'm gonna be looking for a blood pressure.
Okay.
Meanwhile, could I get a third SpO2 reading.
Sure, so you put on your non-rebreather and they're up to 95 now.
Okay. Could I get a respiratory rate?
They're at 18.
Viri, can you write down the vitals?
Yes.
I need you to relax your arm, please. Do you have a watch? Do you have a watch?
Just 20 seconds. I can make it. And then I'm gonna go ahead and take a
Just
pulse.
click it on the bottom right here.
I mean the thing has a pulse. But you gotta take a pulse. All right. So I'm gonna go ahead and take a pulse. I'm doing this for 30 seconds and then gonna multiply it by 2.
Okay.
Okay, so I got 38. So I'm gonna multiply that by 2. It's 76. So I have a 76 pulse.
Okay, so your actual pulse is 102.
Okay. And then also, I'm gonna go ahead and check respiration. So I'm gonna go ahead and just have this, and then look for chest rise and fall for 30 seconds again, and then multiply that by 2. Very-
126 over 78.
Okay, so your actual blood pressure is 130 over 78.
And then we're gonna go ahead and verbalize the blood glucose.
Okay, your blood glucose is 92.
Okay. So after a set of vitals, my general impression for this patient is that
Field impression.
field impression. Sorry, yeah, my field impression of the patient is they were having possibly an asthma attack because they had a history of COPD, so they're probably just having an episode of that. So yes, and then the last thing, I'm just gonna go ahead and do a reassessment. So the patient is a little bit more stable. So I'm gonna say that we can reassess every 15 minutes. Do you agree, Jenny? 15 minutes, yeah. So for reassessment, every 15, we're going to be going over the primary assessment, so all the ABCs. We're going to be going over vitals again. And then we're going to check our interventions and then reassess the chief complaint of the patient. So looking at the SpO2 reading, it went up to 95%, so the supplemental oxygen was helping. There's no more wheezes, so the nav kit worked. And then, ma'am, how are you feeling now?
Better.
She's feeling better, so the chief complaint got a little better. And then I think that's.
You keep the primary.
So then I'm gonna finish it off by giving a verbal report. So let's say that I'm transporting to Northwestern Emergency Department, so I'll call in. Hi Northwestern, this is ambulance 3. So we're bringing in a 60-year-old female patient who was complaining of respiratory distress. The patient, we had wheezes bilaterally. They had an SpO2 reading of 86%. They have a history of COPD, so we went ahead and gave her a treatment of albuterol and Atrovent, so via an kit, 2.5 milligrams of albuterol and then 0.5 of Atrovent. Following that, the patient was still complaining of shortness of breath, or they were struggling to breathe, so we supplemented with 15 liters of oxygen. And then we're about 5 minutes out. We'll see you soon. Any other questions?
All right, they let you know that that's all, and they'll see you when you get there.
Sounds good.
Right on.